what are the surfaces and borders of the heart in situ. In situ means in position. So we can see this is the apex, base, this is the base. Alright. Now let us understand what are the various, the partitions, okay, and the chambers which are present in the heart in situ position. Usually you must have studied heart, 4 chambers like that. But let us understand how the heart is actually present. See here, this is all right atrium. You can see that there is nice groove present between the right atrium and the right ventricle. Alright. So this is called as atrioventricular groove because it is on the anterior side, on the right side. So that's why we call it as right anterior atrioventricular groove. Alright. Now till where is the right atrium? This till the base. You can see that this is all groove. Alright. This is entire structure is the right atrium. Okay. Now how do you identify atrium from ventricle? Just keep your finger on the surface. You can see that atrium is thin walled, okay, whereas ventricle is thick walled. You can easily observe that. So this is all right atrium. Now where is right ventricle? As you must have studied, it is not below the right atrium, it is left to the right atrium. Okay. It starts from the base. Okay, this is the pulmonary trunk. Pulmonary trunk dividing into 2 pulmonary arteries carrying deoxygenated blood from the right ventricle to the lungs. Okay, so this is the pulmonary trunk. You can see that this is the pulmonary trunk and this entire structure is the right ventricle. Till where is the right ventricle? This is the apex, right? So you can feel that. When you hold the heart, you can see that there is a groove here also. So this is the groove between right ventricle and the left ventricle. This is called as interventricular groove. Because it is present on the anterior side, we call it as anterior interventricular groove. Okay? So between right ventricle and the left ventricle. So you know how the right ventricle is present right now. Okay? Where is the rest of the right ventricle? It is on the back side, on the posterior surface. So now this entire left border, see we have now borders. This is the right border of the heart, this is the left border of the heart. Okay? This is the apex of the heart, this is the inferior border of the heart. So right border is formed by right atrium. Left border is formed by left ventricle. Okay? So inferior border is formed by right atrium, right ventricle, left ventricle. Apex is formed by left ventricle. Okay, apex beat. We call it as apex beat. Usually we hear with stethoscope auscultation the left ventricular systole. Okay, that's called as apex beat. Okay, now this is the base. This is the posterior. So this is the anterior surface. Anterior surface contains right atrium, right ventricle, left ventricle. Okay. Now we are looking at the posterior surface, or can we call it as diaphragmatic surface because it is sitting on the diaphragm. So on diaphragmatic surface, what we will see? We will see only 2 ventricles. We don't see atria here. Okay. What is this ventricle? Right ventricle. Right ventricle. Okay. Right ventricle. This side, left ventricle. So majority of the the diaphragmatic surface is basically formed by the left ventricle. So it is a 3-dimensional structure, you see. So some part is on the anterior side and most of it is on the back side. Okay, what posterior surface or the diaphragmatic surface. Now let's see the base, how the base is formed. You can't see base, right? Why? Because it is hidden inside. Now there are something called as, you can see the spaces. Okay.